COVID-19 cases reaching new highs across Texas tonight. And unfortunately, the numbers look more like what we saw during the summer surge. Right now, more than 7,000 Texans are in the hospital fighting COVID-19. That's the highest number we've seen since August the 12th. Here in Southeast Texas, all of our 86 ICU beds are full. We have team coverage. Amelia White is tracking the situation in Jefferson County. But first, let's go to Lauren Hensley, who's been digging into the data on ICU beds. And Lauren, not all of these patients have COVID-19.
Yeah, Jordan, that's right. And numbers provided by the Southeast Texas Regional Advisory Council shows that all 86 ICU beds are currently full in the county, and the county's backup facility also out of ICU beds. Jefferson County Judge Jeff Branick says now is a critical time and our hospital systems must implement their backup plans. Here's a snapshot of the numbers. There's a total of 86 ICU beds in Jefferson County. 18 of them are occupied by COVID-19 patients. The other 68 are occupied by patients with serious heart issues and other major injuries. Mid-Jefferson Extended Care Hospital in Beaumont has been tapped as the county's backup facility. According to the chief operating officer, all 30 beds are full, 25 are with COVID patients. We spoke with Torch, a Texas organization dedicated to addressing the needs of rural and community hospitals. A spokesperson there concerned about our region's hospitalizations.
And when we exceed our ability to treat, bad things happen, people die.
According to Henderson, our local hospital systems must now implement surge capacity plans. We asked Judge Jeff Branick what that looks like. He says hospitals are required to add an additional 24 beds, bringing the county's total to 110 ICU beds. If the need keeps growing, the state has more guidelines to find open beds.
The second layer of that is you expand into non-traditional areas like nursing homes and surgery centers to increase capacity. Then there's a plan to actually go into convention centers, things of that nature.
Henderson says we can all do our part to help relieve the pressure mounting on an already strained healthcare system.
If we're going to control this thing, it takes everybody working together and doing everything they can to stay safe.
We reached out to Christus and Baptist. Christus responded saying in part it has a few ICU beds open in its hospital system, so it appears the surge plan has already been implemented at Christus. Lauren Hensley, 12 News.